So dysphagia. Dysphagia is difficulty in swallowing. Difficulty in swallowing can be mechanical or neuronal. The dysphagia can be because of solids, because of liquids, because of both. If usually solid dysphagia to solids, we attribute to the mechanical esophageal problem. But when somebody has dysphagia to liquids, we think in terms of neurological disorders. So patients with stroke, especially brainstem stroke, will have difficulty in swallowing, and sometimes we may have to feed them permanently. They may be on nasogastric or orogastric tube feeding for a long time. And if for some reason the patient needs a longer time tube feeding, which you cannot give obviously from the Riles tube, we may have to, because a lot of complications, and you have to compromise the oro dental hygiene, and patients may develop sinusitis because of this tube that is lying in the nose for the long time. So for these reasons, we do not give not more than 2 or 3 weeks of Riles tube feeding. But in a patient like what I said in stroke or some other neurological indications, the patient requiring long-term tube feeding, we have to give a gastrostomy tube or jejunostomy tube. So what is classically what we call it PEG. PEG is percutaneous endoscopy gastrostomy. PEG or PEG, and percutaneous endoscopy jejunostomy. So the tube feeding directly, we feed into the stomach or jejunum depending on the requirement of the patient. So that is the esophageal. Esophageal related diseases are, we discussed recently when we are dealing with respiratory system. We were talking about esophageal rupture causing spontaneous pneumothorax or bilateral pleural effusion. So the esophageal diseases are plenty. Motility diseases, esophageal motility diseases are also very common. That can cause GERD, reflux of the acid gastric contents, and causing GERD symptoms. So esophageal diseases plenty. When we are coming to the esophageal diseases, we'll talk in detail. And esophageal cancer, especially people who smoke, people who are habituated to drink hot coffee and hot tea. Some people cannot drink medium hot tea or coffee. They just finish off within, before you even start sipping first sip, they would have finished their entire big mug of hot coffee. These people are more prone for developing the esophageal cancer. Sorry? Mug will be still hot. Yeah, mug will be still hot. So we have come across a couple of patients who have habit, and smokers. Yes. So as I said, the food gets pushed down due to the peristaltic, that regular peristaltic movements. And these peristaltic movements also is a very movement disorders, esophageal movement disorders are a separate topic. We will come to that when we reach there. And vagus, especially vagal related problems, and in the brainstem stroke or other things, we have these esophageal related motility disorders. And coming down to the stomach, as you all know, it's a there's a lot of functions about stomach. Not only the storage, the digestion, propulsion, so many functions are there. Stomach has a columnar epithelium around. This epithelium is not just a simple layer, but it secretes a lot of hormones, enzymes, like gastrin, histamine, and acetylcholine, and most importantly, your hydrochloric acid. Hydrochloric acid, it has to digest the food, but being an acid, it also can destroy the epithelium that the stomach has as a covering. Again, we also have alkaline, the bicarbonates are secreted in by the stomach, so that the acid-base balance. Acid we require to digest the food, but the acid can destroy your own. That's why acid peptic disease and ulcerated hyperacidity, ulcerated diseases are very common. The God has given a balance to neutralize the acid that is present in the stomach. He has given bicarbonates, the alkalis. So if this balance of acid and base get disturbed, one get acid peptic related diseases. So these are the cells. This hydrochloric acid is secreted by the parietal side. Hydrogen and chloride molecules are secreted. They become hydrochloric acid. So, what are the functions of stomach? This is the stomach. What are the functions of stomach? Functions of stomach. Mainly the digestion. Digestion is not a simple just mixing up like your mixer. Digestion has different stages. Stomach first acts like a reservoir. Whatever you are dumping in, it will poor stomach will accommodate so much. Sometimes you overeat, sometimes you tend to eat all rubbish and all. So the stomach tolerate all that rubbish that we eat, and it will act as a container, as a reservoir for some time. Then it empties into the down. What is the normal gastric emptying time? Your answers, please type on the screen. Anyone? Zishan from Kyrgyzstan, you can type, Dr. Zishan. What is the normal gastric emptying time? 2.5 to 3 hours. Again, it varies from the type of food that you are taking. You're taking liquid, solid. In the liquids also, the clear liquids pass off very quickly. If you're drinking milk or the soup, it will take longer time. So usually the 60%, 40% of the emptying takes place in the first 1 hour, and the remaining 30% in 2 hours. And then last about at the end of 4 hours, the remaining 10% also gets out of the gastric outlet. We call it a gastric outlet. So we have a sphincter. Can you show here? We have a sphincter here, gastroesophageal sphincter, and we have a pyloric sphincter. These two sphincters act in a highly coordinated way. When the food comes here, the pyloric sphincter is closed, and so that it has to accommodate and then start digesting and mixing with the hydrochloric acid. And when the food comes and stops here, this is closed, and after 1.5 to 2 hours, slowly it starts opening and the contents are driven down into the duodenum. This is the beautiful mechanism which is controlled by neuronal, hormonal, and local mechanisms. The signals go to the brain, and we have a beautiful gut-brain axis. Everything, all the digestive system, what all the digestive properties that we have in the GIT, they are all controlled by your sympathetic and parasympathetic nervous system, without which there is no motility, there is no movement of these intestine. That's what is called as gut-brain axis. That's why when you overeat, you tend to sleep. You get sleep. Most of the times, post-lunch classes when we take students, some students sleep after the lunch session. That is because of the gut-brain axis. So the point here is the brain controls your digestion and your movements of the intestine. So it acts as a reservoir, and it secretes the enzymes, and it also secretes acids, and the motility. The motility also is very important. Sometimes because of some motility related disorders, the emptying time may be delayed sometimes. So what we call it as gastroparesis, especially seen in diabetic patients. Gastroparesis, the gastric emptying time is delayed, and patient will feel like as if they are bloating. The stomach is full. They don't feel hungry even after 6 to 8 or 12 hours after taking the food. So these are the four main steps of digestion: reservoir, acid secretion, enzyme secretion, and motility, GI motility. So gastric cells, there are a lot of cells that are present in the stomach. It's not just one layer columnar epithelium. They have foveolar cells, there are chief cells, there are parietal cells, there are G cells, the enterochromaffin cells, and mucous cells, and endocrine cell. Stomach also is a small endocrine gland. It secretes gastrin, which is a hormone. So other chemicals, these secrete, they secrete into the stomach, the lumen. But whereas the endocrine function, the gastrin directly is secreted into the blood. That's why we call it as a endocrine. So endocrine secretion also is part of the stomach function. So the mucous cells, they secrete alkaline mucus to neutralize the acid, to prevent the destruction of the mucosa, the lining of the stomach. And parietal cells secrete hydrochloric acid, and most importantly, intrinsic factor. Parietal cells also secrete intrinsic factor. You must have read in physiology, you must have uh, uh, understood the mechanism of intrinsic factor, this secreted by parietal cells. This intrinsic factor is very helpful in the transport of vitamin B12 that we take in our food. So it acts like a vehicle and it carries the vitamin B12 to the site of absorption. That is, what is the site of absorption B12? Terminal ileum. Very good. That is the answer. To take the vitamin B12, we need intrinsic factor. Whenever there is a deficiency of intrinsic factor because of any gastric diseases, you get B12 deficiencies.